Thank you. Our topic today is why did I have to miscarry and what can I talk to my doctor about and after a miscarriage. If you don't know who I am, I'm Erica Hoke. I'm an infertility coach, and I myself has suffered my own miscarriage um, less than a week, and was told I would need donor eggs, and then I conceived, had a set of twins, and then 7 years after my diagnosis, eggs gave birth naturally to the meeting without reproductive medicine to my last son. So if you're watching this morning, touches you personally and you have suffered a miscarriage, please go ahead and draw, or if you're on replay, let me know if you've gone through a miscarriage. It's honestly one of the most painful things that I've ever gone through, and it's kind of inevitable that some women go through more and over again miscarriages, sometimes unnecessarily. We're going to get to that in our points today that I'm going to share with you. So let's talk out stats, if I can talk. So let's talk stats for a minute. So from the Cleveland Clinic, they said 50% all miscarriages are due to genetic abnormalities of the fetus, meaning parent B did not have a D that contributed to that. It was something in the genetic makeup of the fetus. It's the baby, the embryo, and that was what led to the demise of the baby. So we have a whole nother 50% of the time over here, and 1 in 4 pregnancies end in miscarriage. So that is like a gulf, unexplained miscarriage. And unfortunately, that do some additional week testing, I really focus on additional miscarriage support, infertility empowered, because unfortunately, there's testing to be done on the mom, done for you, that can determine answers and keep you from having more miscarriage. That's what I will do, is provide information for you so that you never have to go through that suffering again. So the first thing that can cause a miscarriage, that can contribute to repeat miscarriage, is infection. And so one of the most common and overlooked, and I hear more, and I'm glad and suffering, but that it's coming to the forefront as a test that needs to be something that needs looked at, is something called Urea Plasma. So I'm not going to go into all the details about Urea Plasma. I actually wrote a blog post about these tests to my blog, on my website, just my first and last name, ericahope.com. Urea Plasma is a microbial infection that is many not symptomatic. You don't have any symptoms other than infertility and repeat miscarriage. There's also something called bacteria vaginosis that can cause miscarriage. That's well. Group B strep, which if you're suffering from fertility, then you might know the first time before your delivery for group B strep, and that can actually, so infection can cause miscarriage, and you should get some additional testing after your miscarriage to see. So the second thing that can cause miscarriage is hormone irregularity. So progesterone is I guess in Western medicine world, but I see again book contributing authors that have had their progesterone levels supported and gone on to have healthy after their miscarriage. You kind of take that to heart, right? Thyroid. I speak a lot about thyroid support in my group, and thyroid is a football field. The normal range is like I see it's field wide and symptomatic. If you're still experiencing thyroid symptoms, your numbers are good and that really big foot, you needed to be over here to feel better. And it also for your what I like to call your personal thyroid number for yourself for pregnancy, because just range doesn't mean your body can support a pregnancy with that thyroid range. So I often look at in my coaching program. Okay, so the third thing is improper implantation. And so a few different things. So this can be structural. So we see uterus abnormalities and sometimes caused from physical things in the uterus, things in endometriosis, things like fibroids, distorting the contour of the uterus. I had both of those things, by the way. And some kind with I have something called factor V Leiden. Factor V Leiden can contribute to the embryo not being able to implant wall. So this is unfortunately a very heartbreaking condition for some people because they go through multiple miscarriages only to be diagnosed with factor V Leiden, get on blood thinners, and then understand that all of those miscarriages could have been prevented. That you can talk to your doctor about. Clearly, I'm not a doctor, but these are things that I've been with my clients, and unfortunately, it's just not talked about enough. A lot of people don't even share miscarriage. A lot of people ask their doctors because they're brushed aside. Now, I'm not dismissing the fact that marriage can just happens, but that's clearly not statistically the case. Definitely can be for you some additional testing to be done. So I am going to write up a blog on information I'm getting on my video. I like to keep it to 5 minutes, and I'm over that. So with you on Friday, or here Monday, Wednesday, and Friday at 9 a.m. for my summertime hours. Summertime here. And I hope you have a great day.